So this, Ben, is going to be such a big conversation. My hope is that we can just talk about racism in healthcare in a way that there are some really good takeaways for our viewers. So when people ask you, is there racism in healthcare, what do you say?
It's undeniable, irrefutable. The data is there, it's proven and shown. And it's surprising to me that we still have to ask that question. There was a landmark study done in 2002 by the Institute of Medicine. They bring a bunch of specialists together. They look at all of the literature around a particular topic, and they put together these huge tomes of compilations of information. And in 2002, they did one that they ended up entitling Unequal. And it looked at all of the data that had been done to date and tried to control for anything other than racism, and throughout the healthcare system, throughout the healthcare literature, throughout the health outcomes for many different diseases, racism showed up again and again and again. And since then, study after study after study has really continued to reinforce that at every level that you can measure.
So let's talk about what that looks like. When you talk about racism in healthcare, how does it manifest itself?
From the very beginnings. So I hope a lot of people are more and more aware of these things, but if you're a black woman in this country, let's say you're a black woman who has reached the heights of education and therefore pretty comfortable socioeconomically. Let's say you were the greatest tennis player of all time in this country. The chance of you dying in pregnancy and delivery, and the chance of your baby dying in pregnancy and delivery is higher than for anyone else, including anyone else who hasn't finished high school. And so what that means is that the issues of racism go beyond the issues of socioeconomics and poverty and some of the other issues that we also contend with in this country. And you can keep taking it from there. If you're a child going to an ER, in any ER really, across this country, if you're a child who's having abdominal pain, stomach pain because of appendicitis, the chance of you getting adequate pain medication goes down by 80% if you're black compared to if you're white. If you're a child who goes to an ER, this was a study that was just released in 2021, but looked at millions and millions of childhood experiences, kids under 18, going to ERs across this country, 44 different emergency rooms for children. The chance of getting the right imaging study done for your complaints and conditions goes down significantly if you're black or Hispanic compared to if you're white. You can go through just about any age group or condition. The treatment of headaches is different based on the color of your skin. The chance of a woman getting adequate treatment for breast cancer, lumpectomy, or radiation therapy goes down based on the color of your skin. If you're black, you're less likely to get adequately treated in adequate time, and the same is for men. If you have prostate cancer, the chance of getting adequate treatment for prostate cancer and getting diagnosed on time for that adequate treatment goes down for men. I just had a knee replacement surgery, and the data from 2018 shows that if you're black, you're less likely to be offered a knee replacement when it's the right thing to do for you. You're less likely to have a surgery that goes well. Just by being black, not related to your insurance or your socioeconomics or anything else. If we look at even this past year with the pandemic, we learned all kinds of lessons over and over again. If you're black or brown and you work in healthcare, let's say you're a nurse, the chance of you being more in the front lines, more exposed, and therefore more likely to get COVID and more likely to die in the execution of your duty as a nurse goes up if you're black or brown, especially if you're Filipino descent. If you look at what's just happened across this country with life expectancy, what we've seen in the last 2 years has been a decrease in life expectancy that is only matched by the decrease in life expectancy that occurred around the World War II era. For this country, it's almost down by 2 years. For Hispanic, Latino, Latinx Americans, it's down by 3.88 years. Now, for epidemiologists, a change of a month is kind of a big deal. A change in 3.88 years is incredible. For blacks, it's gone down by 3.25 years. These are enormous changes compared to the other parts of our population. So I could probably talk for another 2 hours about this, but I will say that in every place and space where we study health outcomes, the differences based on the color of your skin are there. And we all know that there is no actual true biology to the differences in us, me from you. It's only a skin color thing. And so we can't explain these away based on biologic factors.
Wow. So, the only thing that comes to my mind is that people in the healthcare system, when they see a person of color, are not seeing them as worthy as a white person, or they're not really seeing their humanity. What do you think is happening?
I think that's a really good way to think about it. These words, dignity and respect and worthiness, can't help but come into my mind when I think about these issues. That goes pretty far from how you feel walking into, say, a hospital. And there are hospitals that I know of where if you walk into them, you're more likely to be policed, called by security, and have the indignity of being seen as sort of criminalized even in the spaces of healthcare. If you're treating someone who's different from you, especially if you're Black or Latino or other parts of what we call the BIPOC community, something does happen in the way people make assumptions about your pain, about what you need, about how you express yourself. And the best intended, kindest, nicest people you can imagine in healthcare will still practice in a way that ends up resulting in racist-based disparities in health outcomes. It's a powerful statement about how deeply woven in racism is to all of our deeper column infrastructure, our businesses, our education, our healthcare.
When we think of that in that context, it seems that it's so deeply ingrained in the system. How do you fix it?
There are so many ways to start and so many paths that we need to take. I think the most important message, if I'm talking to anybody, any audience, is the important thing is to start, to really be committed to it. One challenge our healthcare system has is not really wanting to talk about it. I just have to mention quickly, there was an article in the Washington Post from this spring that spoke of a Black physician who was doing research on racial differences in health outcomes. And he kept titling his work Racism and Different Outcomes in Liver Transplants and things like that. When he submitted them to journals, they would erase the word racism and place something else, intolerance or just difference. And it really spoke to this idea that healthcare, medical journals, medical science, as objective as we try to be, really struggle with being honest about what is happening in our midst. We have to start. And that starts with, I think, really lifting up a true desire to see the dignity and the worthiness in everyone, to use your word again. I think we have to start with helping to understand and see where our blind spots are, where our biases show up, and where we are making decisions, often unconsciously, that lead to different outcomes. We have to create a much broader diversity of people in the profession, and that we have a long ways to go in order to do well. And we have to create a culture and an environment within that field so that that diversity actually has a chance to shine.
So when you went to the University of Washington Medical School, you told me you were one of 2 Black students in your entire class.
That's right.
What was that like?
It was interesting. It was a bit of a challenge. I think that I still come from the leftover part of a generation or two that was really trained by our Black mentors to try to be twice as good, to be girded, to be ready to enter into spaces where no one else is going to look like us, to be able to speak and hold ourselves in a way that we're very conscious that whatever we do reflects on a whole bunch of other people who do look like us. And so that kind of countenance and requirement and the energy that goes into that every day, it's kind of exhausting. What I'm glad about is when I see some young people coming into the field from BIPOC backgrounds, they're a lot less tolerant for that sort of shifting and hiding and shielding of who you are. They demand something different, which is inspiring to me.
Yeah. You're teaching now at the University of Washington.
A little bit, yes.
What are some of the students saying to you about the issue of racism and the fact that you've been in the industry for a long time? So when students of color come up to you and have those conversations, what's top of mind for them?
I really enjoy, I guess I'll put it in quotation marks, teaching, because I end up learning so much more, especially from the students that I get to spend time with. So I think it's a co-creative, co-learning, co-sharing kind of environment, but it takes too long to say that, so we'll just call it teaching. What I hear from BIPOC and LGBTQ plus identifying young people, from folks who've experienced different kinds of marginalization and oppression through generations often, is an expectation of something better, a need for us to follow through on our promises. And I think as a country, we've made a lot of promises about humanity and about how we're going to treat each other. We had a lot of good lessons in kindergarten and in our early learnings about how we should regard our fellow human beings. And I think that young people today are calling it out and calling it in, calling me in to do a better job of standing up for that, calling me in to give me permission to be a little more outraged and express that outrage rather than cover it up, calling me in to call it out, calling a lot of folks to account, to be more transparent, to be more understandable about how decisions are made and how things happen, and to actually be, I think, loving dismantlers, if that makes sense.
Yeah, of an institution that's been
Yeah.
doing the same thing for centuries, right?
Yep, institutions with good people and good intentions.
How important is it, Ben, for our healthcare system to look like, in terms of providers, to look like the population? I think in 2016, about 13% of America was Black. Mm-hmm. How far do we have to go, and how important is that my doctor looks like me and your doctor maybe looks like you? Is that important?
You just have to remember that it is an important step. It is an important part of this whole conversation. It has elements that speak to just the fairness of opportunity of becoming a physician or a healthcare provider or in this field in any way in the first place. And that's a path that requires a lot of dismantling and recreation before that happens. It's a necessary space because when you feel like you've not felt welcome in so many spaces in your life, I think we should really commit to making sure that when you come for healthcare and you're talking about your most private and personal issues of your health, talking about your body and wanting to trust someone to take good care of your body, there's no other place that's more important to feel welcome, to feel a sense of belonging. And it helps when you look across, I guess it's the exam table, and the person with the stethoscope looks like you and maybe is even able to say, I've actually seen part of that journey that you've been on. It's not my journey, it's your story, but I sure understand some pieces of that, and I've been in places that really reflect some of the things that you're saying. That's important.
How diverse is the current medical class, let's just say at the University of Washington? Does it reflect what it needs to reflect, or do we still have work to do?
Work to do. Progress being made in many ways. So there have been classes in the last 3 or 4 years of the medical school that have had 6 and 8 and 9 Black medical students, for example, compared to the 2 that was for me. The class sizes have actually increased as well, so you have to take that into account. However, there's a lot of work to do, and for all of that hard work of recruiting more Black and brown medical students, pre-medical students, and nursing students, we're not keeping up actually with the diversity expansion of our country in general. And there was a study that came out just last year that said, if we're going at this rate, it's going to take more than a century for all of the healthcare-related fields to actually catch up with the population around them. And if I may say one more thing, we even have to wonder if exact proportionality is going to do it. If we stack up hundreds of years of racism and those deeply embedded and deeply rooted problems and challenges that you mentioned as well, I actually think it's going to take a bit of a super representation of those with lived experiences from backgrounds that have been historically impacted by racism in order to really be meaningfully turning the ship. Otherwise, I think we create proportional racism, and that might not be progress.
Right. It's not just a numbers thing, is it?
Right.
I want to talk, if you're willing to, about what happened at Seattle Children's. You were the head of the Odessa Brown Children's Clinic for many years, and then you decided to leave because of racism, if we just say it for what it is. When people ask you, what happened, Ben, what do you tell them?
I tell them that, in part, I was really trying to explore my own reckoning, because I think any time that we're going to talk about really making fundamental changes in the world around us, it becomes really important for us to start with ourselves. I talk about how I wanted to be more aware of the things that were happening around me, and I was seeing things happen to other folks who were speaking up or who were deemed somehow questioning issues of not just racism, but gender bias and other kinds of issues of transparency, and how they were treated by this particular hospital. What was happening to them? They were being disappeared. They were leaving, and they were being muzzled by non-disclosure agreements, and suddenly they were just gone. It felt like there'd been a trend of a hospital going from a place that was pretty connected to its people internally and to its sense of mission outwardly. When I first started there, some 100,000 years ago, 25, to a place that was kind of getting corporate and big and losing track of some of the values that it still spoke about, but it was hard to see that in the actions. I talk about personal experiences, and as you say, there aren't that many people of color reaching healthcare fields. It becomes a thinner and thinner, more rarefied air when you talk about healthcare leadership. I was a sort of leader, middle-level leader for the hospital. I looked around, there was not another black male that I knew of at the hospital, and this is a place that is now 12,000 strong in its staffing. There are other folks of color, women, and better gender representation in many ways. However, the spaces and places that were really supporting diversity and equity were pretty disempowered. There's a Center for Diversity, but it didn't seem to actually be able to cause change to happen internally. There were measures happening looking at how the hospital was treating people based on race and ethnicity, which is a credit to the hospital. What breaks my heart is that then there was no action based on revelations like we're not translating or using interpreters often enough, like we're calling security too often on Hispanic, Latino, and Black families. To know that and not act on that felt like like a crime, a social crime. So I looked at all of those things and saw also where maybe I'd been too quiet. Maybe I'd spoken out, but not loud enough in the right ways. Maybe my voice inside was pretty nullified by that point. And the best way to make an important statement about something then was to leave in protest.
Was there overt racism toward you?
Toward me, yeah. There are experiences that I endured and held on to that go back even almost a decade, where racially harmful and really egregious language was used in reference to me, and also other language used in reference to other ethnicities, and really misogynistic language as well. And it was not addressed. It was not adequately dealt with. And that was happening from hospital leadership level people, like really top leader level people. And the retention of a person who uses that kind of language, it seethed and burned away. I think a last straw of many for me was around this time last year when the same person who had used the N-word in describing me had also suddenly been touted as a champion for diversity, I think was the term that was used. And that's when you just realize that words and actions, words and impact are completely different in that space. And something really significant needs to happen to splash water in the face and get people to really recognize that this is a problem that we can't hope to, I'm sorry for this word, but we can't hope to incrementalize ourselves away from that. We need to take bold action. And I mean we, every one of us, you lifting up these stories, all of us who are involved in the work that we do and the people around us, all of us that care about the fairness and the foundations that we say we believe in, we need to be bolder. And so I called on myself to be bolder as well.
And you had no plan B.
I had no plan B.
No severance pay?
No severance. If you took a severance, you'd have to be quiet. I wouldn't be able to talk to you. I didn't have some other lily pad to hop to. I didn't have another job lined up. And I had promises to my wife and to things like that where I really was asking others to take a chance with me in that time.
Recently, 100 Seattle Children's employees walked off the job in protest. They want the full report released. When you heard about that, what went through your mind?
I share in their outrage. I'm moved by that strong voice, and they're calling for that not about me. They're calling for that about the hospital, about a love for a hospital that they know can be better. And I think that's really, really powerful. I know that the hospital sent out a bunch of emails the morning of that walkout and scared many, many staff into not walking out. Made sure that the nurses union scared nurses about walking out. So the fact that 100 still did, that is a kind of courage and a kind of bold action that I think says that for every 100 people that were out there, each one of them had another 100 behind them, really, in that protest.
Ben, we've talked about this issue recently, and you say that we need to have measurable outcomes when it comes to fixing racism in healthcare. I'm wondering what that looks like. What are some things that we can measure as we try to fix this?
Well, there are a lot of good ideas out there that exist already. There are a number of people, so many people smarter than me, who've put a lot of energy into thinking about this. So I just want to start with saying, we do not have a dearth of solutions. We do not have an absence of answers. We do not have a lack of strategies or ideas. I'm just going to be bold and say we have a lack of will. A lack of will. So the measures that we could be making are pretty clear when it comes to how we're creating opportunities for young people of color to consider fields in healthcare, for example. How our recruitment processes are happening to medical schools, how our retention in medical school is doing, how are we graduating medical students across and disaggregated by different racial backgrounds. How are we hiring and retaining staff at places like hospitals broken down by racial background and other forms of disaggregation? How are we creating opportunities for advancement so that those C-suites, is that the term? Those places where executive leadership reside are not just one singular race and one singular gender often. These are all measurable things at the environment and staffing and diversity level. In addition, we know where the gaps exist in health outcomes. I will even be pushier than that and say, I don't even feel like matching outcomes across races should be our goal. And I'll just say, as a part of the healthcare profession, we don't have a healthcare profession with good outcomes for anybody when you really break it down.
Compared to other countries.
Compared to any other moderately or more developed country. And so I would not stop at matching badness across lines. I think we should be aspiring to something much more excellent, much more beautiful, much more bountiful, much more incredible. We have a country of amazing abundance in talent, like in individual talents, in addition to resources and the wisdom that we've gained from our ancestors and our grandparents and that we get to pass on to young people. We have this wealth in every way you would describe it. We can do better. We must do better. We cannot leave our time in this world allowing things to continue the way they are.
I want you to speak, if you would, Ben, for a moment to that person of color who may be watching, because it seems to me that until these problems are fixed at the systemic level, it seems like a person really needs to know how to be their own advocate within the system. Can you give some advice to that person?
So I'm a pediatrician, so I'm just picturing maybe some of the young people I get to see in the course of my work. And what I want and try to say to them, first off, is that they are brilliant, that they possess incredible talents and attributes, and as far as they can dream is as far as they can go. And that idea and that feeling needs to stay with you throughout your childhood and into your adulthood. That just has to be there. And we have to do everything we can to make sure that that stays. The conversations that we have about issues of racism and unfair outcomes in healthcare and things, it can lead you into talking about deficits, about what's not there for people and how we can fix deficits and patch holes. A lot of the time what that does is make you think about people in terms of what they don't have and makes you forget to talk about people in terms of what they do have. So I want to say to that young person, let's talk about all of the things that you have that make you incredible and brilliant and wonderful and makes you the person that I'm gonna smile and lean back someday and watch you change the world. I want to say to a young person that I absolutely have your back, that I'm actually willing to be led by you and your dreams and your ideas and support that vision and change the way I do things to make sure that the way that you get to do things is better. I want to tell that young person that the power of love and the power of what we can be is so much more powerful than the language of hate and the actions of hatred that we see around us. They are in your face and they are dramatic, but they are so less powerful than the power of love and the power of humanity that we can draw on and support each other with.
In terms of being a patient in the system, Ben, what advice can you give that patient when they go to the doctor?
Yeah.
And they feel like maybe I'm not getting the treatment I deserve? I mean, what's your best advice to them?
All right, I'm going to come back from the clouds and get practical from two different views. One is from the patient view, and I think that you deserve to have somebody who, in some way, you feel like is trustworthy, and that could be somebody who looks like you, could be somebody with a lived experience that's similar to you, or somebody who is intentional and has shown that they lift up who you are in real ways, and that's important. You should be a consumer of dignity, and that should be part of the way you approach it.
You should feel valued.
You should feel valued, and you should seek out value, and you should let the systems know where that kind of value doesn't show up, because the systems might not be measuring that kind of value. They might be measuring some other outcome. You should think about if you're forced to go into spaces where you're not sure how you're going to be treated. And let me just be real. If you're a very, very high-level children's hospital serving a region, not just a community, not just a state, but 6 regions, 6 states or more, you are going to have people traveling far, relying on you for the sole quantitative talent that exists there, the particular surgery, the cancer care, the special treatment for the special and rare disease. We need to hold a hospital accountable so that you don't have to lose your dignity in order to get care that is a very, very limited resource, you hold a special access to a special tool that people need, and you should be able to expect that that treatment is going to come with a sense of value and a sense of dignity. If you work in a hospital, let me just flip that a little bit. There are good studies that show, there's a survey of nurses, and 63% of them had seen in the last 6 months, I think, an act of racism, of poor treatment for someone else based on the color of their skin. It wasn't the nurse themselves receiving that treatment, although that happens too, but it was a nurse observing. And this other question we have to ask is, how do we help people within systems be better at speaking up and speaking out and noticing? And I think there needs to be a lot around what our supervisors are doing to support them, how to create just the skills to notice something, not tuck it away forever until it's harder to both report in detail and harder to get accountability for. Have documentation practices and processes that allow you to make sure that you know who was there, what you heard, and who else can say that they heard it as well. We need some systems in place to actually make it more, until we have a better system, we need to make it more possible for people to notice the way the system is letting us down.
Yeah. What keeps you going? You've been, I don't want to make this sound negative, but you've been fighting. You've been fighting for decades. And I don't know that maybe fighting isn't the right word, but you've been an advocate. You've been an example. And I know that it hasn't been easy for you many times. So what keeps Ben going?
Sometimes I wish everyone was a pediatrician, because for everything that you see that feels like a struggle and feels difficult, boy, if you walk through the doors of the Odessa Brown Children's Clinic today, without me there today, first you're going to walk into a space that celebrates these different cultures and languages and experiences and beliefs in such a powerful way that would make you take pause and make you think there's something better among us, not out there, not in some theoretic future, but among us right now. If you spend a little bit of time looking around and you see a few kids there, some of them actually maybe, I don't know, well-to-do Boeing parent kids, and some of them might have just emigrated 3 months ago, and they're playing together. And what you see and learn is that the power of relationships at every level, from who gets to go next on the toy mushroom to how we talk about making a better world. The power of relationship is the power that feeds us in improving the things around us. And you just can't ignore that when you see it. And if you look into the eyes of young people and you see the promise that they hold, and in a way, what's mirrored back to you is the expectation that whatever you think is hard is not that hard. And whatever you think is making you feel frustrated is so worth it. So I've been able to be supported by that for a long time. That's my cheat sheet, I guess, my way of really understanding and being grounded in every day. I also think that I think we should be a bit outraged. I think we've known and talked about things for a long time, and maybe we've talked about them with too calm a voice. I forget who said, if you're not outraged, then you're not quite awake. But there's some version of that I think we need to embrace. And that doesn't mean that anger or outrage needs to lead to negative things. But I think there's a sort of love that can come from outrage, a sort of creativity that can come from outrage, definitely a sense of being in this together.
Yeah. Because we are talking about people's lives.
Talking about lives. Yeah, and futures. And we're talking about dignity. And I will not ever stop caring about dignity. And I hope that all of us feel that way.
Wow. What's the takeaway from that? What's the outcome? What do you feel like things are changing enough at Seattle Children's?
To be honest with you, I really don't believe that the leadership at Seattle Children's has earned the privilege of actually making the changes at this point, there's been such a recalcitrance. I mean, just even look at what happened in the last month with not really being willing to share the findings of a report, which reminds me so much of not being able to respond to the policing of Black and brown families in the hospital. It reminds me of not improving on language access services. This, we know it, but we won't do anything about it, has shown up over and over and over again. And at this point, I think it's really said to me that that leadership is such a problem that it can't remain in place and still see children's become what it really could be. I think in addition, one of the grounding ethos of equity is that those most negatively impacted by some of the challenges that society puts out there are the ones with the best answers. And I will take that a step further, are the ones to whom we should feel accountable in our work to make things better. And so there's a lack of accountability to communities, maybe especially to communities from BIPOC backgrounds, especially to communities that have experienced some of the worst outcomes even directly from children's in terms of the treatment and the indignity that they've experienced. There has to be a reorientation to those communities and say, we are accountable to you. It's a truth. It actually is a statement of truth. It's not a, we want to be accountable to you, but I think a hospital like Children's needs to say, we're a nonprofit hospital. Our nonprofit status is predicated upon how well we are serving communities like yours. Everything that we say we care about is related to our service to communities. So we are accountable to you as community, not to some corporate model or to some, I don't know what else, the measure of other hospitals and how we rank or any of those other things that seem to be motivators.
So you think that the current leadership needs to go?
I'm convinced, and I'll be honest again and say that was not the way I was feeling in December or when I first really resigned from my position. I was still hopeful that leadership could be sort of owning the mess that it made and really I think it's an honor to kind of go through an improvement process like that. What I've seen since then has convinced me of the same thing that many of my mentors and other folks around me in community have been telling me from before, that the current leadership really needs to go. Should have done the right thing and should have resigned by now. And I find it baffling and outrageous. It's an outrage that we still have the same leadership in place. If there were any other sort of performance measure other than racism, I know that a corporation like that would never retain the leadership that had that kind of outcome of performance under its watch. You know that. There's no organization that would tolerate that kind of malperformance in any other measure.
So you went through this period of, I'm sure, great uncertainty, maybe some fear of what am I going to do, the unknown. Now that all that's in the rearview mirror at the University of Washington, how does Dr. Ben Danielson feel today?
Thankful. I would never have known how many incredible people were willing to step up and step out and really take their own risks in order to talk about issues of racism that are replete in so many corners of our society. And it takes your breath away to think of the number of people who've been willing to either personally say, tell me what you need, or have done their own work in this space. And we have a pretty cool city when you think of it that way. I think it's been a good experience probably in making me say to myself that I have value, because I think I've existed in the imposter syndrome part of this profession for all of my time, and I've had to say I have value enough that I know that I can jump off that cliff like Wile E. Coyote and be in that air for a minute and that something will find a space for my feet to land on. And that's been a really important lesson. I've been gifted with a little more uncertainty, which I think is probably good for us. I've taken most of my steps in my life with a pretty clear sense of what was next. And I've tried to find a different way to be of service to community and to think about what it means for a young person, not only to be healthy right in this moment, but to have the health prospect that makes their future more open, brighter, full of more possibility. And I think that's a huge privilege.
There's one thing that I just wanted to get on video that, we've talked about this before, but I think it would be enlightening for some of our white viewers to hear from you. In communities of color, you have that talk of you have to be twice as good or thrice as good. Take us through what that looks like and when that happened to you.
It's interesting you ask that because, now I'm really questioning how that talk should change coming from me. But I had a number of mentors, or I called them street moms when I was growing up in DC, who were always willing to tell me things and teach me things. And it was a Black community that knew that its young people needed to find ways to navigate a world that wasn't always friendly to them. And so we get lessons like the talk that just about every Black household knows about in this country, the kind of message that speaks to young people about how to enter the world and be safe. And some of that speaks to being twice as good, that you are going to be assumed to be not as able as other people. And so you have to outperform in order to even reach the same level that other people can sort of coast their way into. You have to be twice as thoughtful about how you show up, about the language you use, how articulate you are, how clearly you speak, how much you can be considered a reputable voice and a reputable presence. I now wonder if that's putting so much work on Black people that's an unfair thing to be asking, and it really is the systems and society that should be changing rather than that talk.
Yeah, so maybe the talk now is also
what you deserve,
what you deserve, and not to settle.
Yeah, and that you are brilliant.
Isn't right. Yeah,
that you are brilliant, just as you are. You have everything you need, and that we owe it to you to make sure that you get every place that you want to be. We owe our young people that. That's kind of part of the bargain of being on this planet.
Well, Ben, it's been a pleasure. Thank you, as usual.
Thank you. I always, I think I need to take a few deep breaths after we have conversations because you draw some things out. But I really appreciate that you are holding these kinds of discussions, and that there are folks that really do seek to see a different world, to see a different existence. And I know that you're a big part of bringing that message. So thank you for everything that you're doing.
Well, thank you. I appreciate that.